a family member to also understand a little bit of the mental health system and how to access it, not only for yourself, but also for somebody of like a loved one or somebody that you may feel may need it. Okay. So in this presentation, we will explore the challenges and opportunities families face when navigating the healthcare and mental health care system while supporting a family member struggling with addiction. It is important to understand these systems to provide effective support and access the appropriate resources. Addiction can have devastating effects on families, including strained relationships, financial burdens, and emotional distress. Families often need guidance and support to cope with these challenges effectively. So, there are several types of addiction treatment, including inpatient rehab, outpatient programs, medication assisted treatments. The choice of treatment should be based on the individual's specific needs. So, the reason I bring this one up just as a introduction is, at some point your loved one may have gone into an inpatient or secondary or tertiary. And just to provide a little bit of information, I just wanted to recap before we start, delving into the actual mental health care system. So the types of rehabs, we talk about primary or inpatient. This tends to be a little bit of a detox or psychoeducation and counseling intervention. Secondary tends to be expanding on skills obtained from primary, whereas tertiary halfway houses provide reintegration into society. Outpatient, helping with the struggles of life on life terms. Aftercare, which includes maintaining the program as well as living recovery on how to live in recovery. And maybe my colleague Dominique, you can just kind of add a little bit in terms of what your take is on the different types of treatment.
Thanks, Keegan. Yeah, so for me, I think, long-term treatment or any form of extended treatment is really beneficial to someone that's coming into recovery, just purely based on the fact that the longer we can tie someone to a program of recovery, the longer we can keep them, the stronger their chances of staying clean and sober are. We can't always guarantee long-term sobriety because of the complex nature of this disease. But obviously, the longer you can keep someone in treatment, the better. So as Keegan mentioned, that primary inpatient rehab, we just do a lot of psychoeducation on the disease of addiction. We work a lot on breaking through denial, because I think that's the biggest issue we face in inpatient primary care, is that a lot of people come in denial, and we have to help them break through that. And that's what the counseling intervention is there for. And then obviously it would depend on each client and would depend on each family's circumstances, because unfortunately medical aid only covers 21 days of treatment. So anything after that would ideally be a cash payment. So we usually always recommend secondary care, because that's where they can expand on the stuff. It's a lot of internal work that they do from what they've obtained or learned in primary. And then, we normally recommend a minimum of 3 months in a secondary facility. And then there's the option of the tertiary halfway houses. So for people that, have to go back to work, or, don't have the option to go to secondary care, we always recommend, maybe a halfway house where they can be living in a safe community, but be able to reintegrate back into their life with work, work and families, etc. And then normally we would couple that with some form of outpatient or aftercare program, just to help keep them accountable and in a safe therapeutic setting whilst they're trying to navigate life and getting into a fellowship of recovery. So I think that's what I wanted to add on that.
No, thanks for that, Dom. And if I can just add a little bit more here, primary, secondary, and tertiary, it's all also about the community gets stronger. Like I say, in my personal experience, I see that the primary, secondary, tertiary, as you go up the ladder, the community gets stronger, they hold you more accountable, which is really a good thing. And it's really, really kind of emphasizes the importance of the community aspects. Okay, so I just wanted to recap on that, and now I would like to move on to the role of the healthcare professionals. So we've talked a little bit about your loved one, going through an addiction process, and they may have been part of an inpatient, an outpatient. And sometimes, we're not too sure what that really means. So sometimes it's good to break down these components into the various aspects. So let's just talk a little bit about the role of the healthcare professionals. Healthcare professionals such as doctors, therapists, addiction specialists, they play a crucial role in the recovery process. They provide assessments, treatment plans, and ongoing care to those struggling with addictions. Some of you who have been with us, may have had calls or conjoints with counselors. And this kind of slide is just to kind of show you what each professional does and what their roles. Sometimes it can get a bit confusing, but I hope this slide brings a bit of clarity. So, a medical doctor, MD, or a physician, their role as a medical doctor are trained to diagnose and treat physical conditions, including substance use disorders, right? This is important because they can assess for medical consequences of drug abuse, prescribe medications for detox and addiction treatment, and provide general health care for individuals with addiction. It's not uncommon for people who were struggling with addiction to neglect their bodies, neglect their immune systems. So it is important for a doctor to be involved in the process to kind of assess, okay, are you losing weight? Do you need something for that? Or maybe you just have the common cold, and you need medication for that. So that's where a medical doctor really comes into play to try to get you back into a working condition where the rehab can really then start to work. Okay, so then we move on to a psychiatrist, right? So we got a medical doctor or physician, also known as a GP, a general practitioner, and then we get a specialist called a psychiatrist. The role of the psychiatrists are also medical doctors who specialize in the diagnosis, treatment, and prevention of mental health and substance use disorders. Commonly, we talk about depression, anxiety, substance use disorders, post traumatic stress. These are normally diagnosed by psychiatrists, and they have the ability to kind of design a treatment regime, would maybe include medication, but dependent. The relevance, they can diagnose co-occurring mental health disorders and provide medication management for addiction of mental health. So, we call it a dual diagnosis. I'm sure if you've been with us, you might have heard that term. Dual diagnosis means that there's two diagnoses, one being the substance use and another being depression, anxiety. So a psychiatrist would be able to do a dual diagnosis, right? And that can actually be targeting two problems at the same time. And in the hopes that this will, speed up the recovery. Next, we move on to a clinical psychologist, right? So different from a psychiatrist, it is a close and similar word, but it's important to note that the role of the clinical psychologist, that they are trained to provide psychological assessments, also elaborate on diagnosis and therapy for individuals with addiction and related mental health issues. Their relevance, they offer counseling, psychotherapy, behavior modification, strategies to address the psychological aspects of addiction, right? So they come in with a lot more stronger behavior modification. We call this cognitive behavioral therapy, or CBT for short. And there's various forms of therapy aimed at behavior modification. So, like I said, clinical psychologists and psychiatrists work closely in terms of diagnosing, one kind of, doing therapy in the form of behavior modification, and giving them homework activities of that sort, things of that sort to address those psychological aspects in addiction. Then we move on to a counselor slash therapist, right? And counselors and therapists provide talk therapy and support to individuals with addiction issues, right? So this is important in terms of maybe not necessarily depression or anxiety, or that is held by the clinical psychologist, but sometimes there may be issues like marriage counseling, or things of that sort that need just a talk of approach. So we call that talk therapy, and support these individuals with the addiction process as well. The relevance is that they help clients explore underlying emotions and psychological triggers for substance abuse so that they can develop coping strategies. We will also give them homework from time to time just help them identify triggers. I'm sure you've heard of avoiding people, places, and things. We constantly work on them. We're trying to kind of, make changes in their lifestyle to kind of help with that. Then we move on to a social worker, right? Licensed clinical social worker, very important, because social workers assist individuals and families with a wide range of social and emotional issues, including substance abuse. They offer counseling, case management, and help clients access social services, housing, and other resources to support recovery. While I'm on this topic, maybe I can get my colleague Dominique to just elaborate a little bit.
So I think, excuse me, I think one of the most sort of important points is I just want to go back to the psychiatrist. It's I often come across a lot of families that are very much, against psychiatry. They don't believe in medication. And I think it's so vital to have that as part of your loved one's treatment regime, because there's often a lot of the times addiction is it could be masking an underlying mental health issue, but it could also be exacerbating one. So and because the brain chemistry gets so affected by the use of substances, whether it's alcohol, drugs, that the brain needs some support in terms to try and stabilize someone. So like, for example, that we get someone that comes in with psychosis, we do need to help with medication in order to get them to stabilize, so that we can actually work with them. And it's not to say that. So I think that plays quite an important role, and I just wanted to highlight that, because I do know, and I do come across quite a few families, that are quite against the medication and treatment thereof. And I think the other important thing is, having to work with a like, it's really good to have your loved one working with a multidisciplinary team, because as Keegan's broken down, the different roles and how they sort of contribute towards your loved one's process, is that we're essentially accessing everything from different angles, with different ways and types of therapy, to different sort of counseling skills, which really does play a vital role in your loved one's treatment process. Just so that they're sort of being assessed and looked at from all angles. I think those were the 2 points that I just wanted to highlight.
Mm-hmm. No, Dom, you raise an interesting, point there. When coming into the rehab facility, there's a lot of damage that has been done. So there has to be a lot of healing, and exercise is one thing, diet is one thing, counseling is one thing, but most importantly, I would say, is medication. Like in cases of psychosis and whatnot. So it's understandable that family members would be concerned about the dosages and all of that.
يجيب لك 2 or 3 of those.
So I strongly recommend that if you have any concerns, please contact the psychiatrist, and book an appointment so that you can find out a little bit more information. Okay. So that was that, and the social workers. And then we move on to abuse counselors, right? That is a term that we use for specifically trained to work with individuals and families affected by substance abuse. Now, this also sometimes is called abuse counselors or substance abuse counselors, or sometimes we call them addiction counselors, right? They provide addiction education, individual and group counseling, similar to a counselor, and support for clients in various stages of recovery. What's important to know is that, yes, you're going through marriage issues, for instance, and you have a substance issue. But what's also important is that you're working a program of recovery. And that includes going through the steps, your step work and whatnot. And that's really where an addiction counselor comes into play, because they help guide a person or an addict into the steps and the purpose of the steps and the nitty-gritties of why you're doing the steps, which is important because, Dominique, you can agree with me, a majority of the therapy, the therapeutic intervention comes from doing the step work. And it's important that an addiction counselor is going through your step work and kind of saying, okay, you're honest in this section, you need to be a little bit more honest in this section, and just guide them through that initial phase. Afterwards, they tend to get a sponsor, and that role is being done. But during inpatient, especially in secondary, we do make use of the addiction counselors because they play a very important role, like I mentioned, to just educate and to guide through the process. The next thing that we talk about is a pharmacist, right? Um, talking about the medication aspect, the pharmacist's role is to prescribe medication and offer guidance in drug interactions or the potential side effects. Pharmacists are essential for ensuring safe medication management during addiction treatment. So, just on this note, it's important whether you are collecting medication for your private or for yourself or for your loved one. It's important to always talk to your pharmacist, whether it be at Discam or Clicks or wherever you get your medication from. It's important to always have an interaction. Remember, they are healthcare professionals. They're there to kind of inform you if they have a lot of knowledge about the medication, and if anyone, you should ask them in terms of side effects and whatnot in conjunction with your doctor. So consult your doctor, consult your pharmacist. The more education you have about it, the better equipped you are to kind of combat it. Okay, so like I said, the importance of a pharmacist. We also have an occupational therapist, right? Also forming part of the clinical team. Now, the occupational therapist, his role is there to help individuals regain daily living skills and develop routines for maintaining sobriety, right? So the key word there is daily living skills, right? Putting routines into place. In specifically, they can assist the individuals reintegrating in society after rehab and building healthy, fulfilling lives. For example, strength-based activities, gratitudeless, a person dealing with depression, a person experiencing a lot of bullying for some in the workplace, multitude, kind of putting things into perspective for them and helping them get a little bit of a routine going. Sometimes, the drug addiction or the mental disorder tends to affect a person's way of living, including the way they kind of sustain themselves, like a job. And how do we kind of put a program in place so that they are easily adapted? For example, if you need to go to the outpatient program, how do you kind of manage your time schedule so that you go to work, go to the outpatient program, or go to the halfway house? That's when occupational therapist really comes into play. And they challenge the patient, or they challenge the client to kind of design a foolproof plan so that there's no leakage or there's no kind of uncertainty. Your recovery needs to be quite bolted down, so there's no kind of areas of no gray areas. So that's where the occupational therapist really comes into play. So the next thing we talk about is, for yourself or for your loved ones, understanding, in South Africa we call it medical aid, but in other countries they call it health insurance, right? So I just wanted to go through the difference between having a medical aid and not having a medical aid. It is quite expensive, but sometimes it's good to know the pros and cons, especially in the kind of field of rehabs, and addictions. So I just aim to arm you with this kind of information so that you can make make more informed decision. So let's go through it, right? Having health insurance, right? Number one, it gives you access to treatment. Health insurance, particularly private health insurance, can provide individuals with a bit better access to drug abuse recovery and rehab services. Private insurance often covers a range of addiction treatments. As you know, certain medical aids cover certain programs, and certain medical aids don't. So it's always important to find out, if you do, what it covers. Another benefit of it is choice of treatment facilities. With insurance coverage, individuals may have the freedom to choose from a variety of inpatient and outpatient treatment centers, including those with specialized addiction programs, like I say, dual diagnosis, etc. So check if what your needs are and kind of see if your medical aid would accommodate that. A lower financial burden. Health insurance helps mitigate the financial burden of addiction treatment. It covers or partially covers the cost of detox, rehabilitation, counseling, medication, reducing the out-of-pocket expenses. So this is something that you may want to consider. It is quite expensive on a monthly basis, but should you need it, it can help with certain expenses that were not accommodated for. Quality of care. Insured individuals may have access to a higher quality and more comprehensive addiction treatment service, including evidence-based therapies and multidisciplinary cares. Not to say that anything is of less quality, but once the private sector is involved, there is a lot more accountability, and that is something that should take into consideration. Timely access. This is an important one, right? Health insurance often ensures a quicker access to care, reducing waiting times for assessment and treatment. Mental health services. Many insurance plans in South Africa cover mental health services, which are essential for addressing co-occurring mental health issues often associated with drug abuse. So Dominique, I'm not sure if you just want to kind of elaborate a little bit about your kind of experience with having medical aid versus not having medical aid.
So I'm glad that you asked, because I actually wanted to comment on this slide, because it's something that really irritates me, actually, is that, if we look at health insurance overseas, they offer a lot more than what we get in this country. Medical aids, like Keegan says, it's great to have because it will cover private care, and it usually ranges anything between 21 and 28 days. But in my line of work, particularly when someone needs long-term care, it's not enough. So it's hugely beneficial to have, so that you can access quality care within a treatment center. If without medical aid, to get someone into a treatment facility, it's either going to cost you hundreds of thousands of rands, if it's a private patient, or to get them into a government facility, particularly in this country, is incredibly difficult. They often have six months to a year waiting lists. They have to go through a whole assessment through social workers. It's a very timely process, and it's very difficult. And then, we do get sort of, I would say, I don't want to call them low budget treatment centers, but you get sort of treatment centers that are more affordable on a month-to-month basis. However, they don't provide the quality of care, say, that a clinic with a multidisciplinary team would cover. So it's a very tricky one to have. Like I say, I always joke, you can't not have a medical aid, particularly in this country, but it is, even that's quite costly, but it's a huge benefit when you want quality treatment for your loved one, because I like I say, I mean, I work in the government field as well, and it's very difficult to get into a treatment facility, and it's very difficult to get quality of care. So health insurance definitely plays a massive part. And even in long-term care, if your loved one is diagnosed with a mental health, I don't want to say disorder, but with a mental health issue, most medical aids will cover psychotherapy with a psychologist or a psychiatrist for the year under prescribed minimum benefits. So even then, if you can't afford to pay cash for extended treatment, you can at least still continue getting the therapy they need through a psychologist or a psychiatrist. So I just wanted to add that in there as well.
No, thanks a lot for that, Dom. So, at the end of the day, not the end of the world if you choose not to get medical aid. Like I said, totally up to you, totally up to your finances. It's just some information that I would like to provide you with, so that you know what's the benefits, right? So let's talk about the issues of not having health insurance, right, or medical aid. So limited treatment options. Without medical aid, individuals have fewer options for addiction treatments, particularly in terms of choosing specialized facilities or certain modalities of care. Like Dom elaborated on, not many rehabs approach it in a multidisciplinary approach, or have, when we talk about modalities, we talk about dual diagnosis, or you get a lot of faith-based kind of rehabs, which is good in its own terms, but based on what you need, it's important to check if your medical aid will cover this. If not, what are your options? Then we also talk a little bit about the financial burden. right? The cost of addiction treatment in South Africa can be significant, and the individuals without insurance may face a substantial financial burden, potentially limiting their access to care, right? So this is important because, addiction is something that we consider to be life or death, and if not adequately prepared for it, can lead to, like I say, a subsequent financial burden, which doesn't make the problem any easier. So it is something to consider. So the other thing is a public healthcare facilities, like Dom mentioned, in South Africa, it is quite challenging. Government institutions, the level of care, those are things that you may want to take into consideration. For those without a healthcare insurance, the public healthcare system may be the primary or only source of addiction treatment, which could lead to longer waiting times and potentially less individualized care, right? So, it makes sense to say that if you are approaching it with the public healthcare system, that you may wait longer waiting times. Not to say that you won't get the care, it just may take a little bit longer than as a private would, right? As well as more individual care, that is also an important component. Affordability of medication. Some prescription medication used in addiction treatment may not be affordable for those without insurance, affecting the effectiveness of the treatment plan. Going back to the first slide and the importance of medication, especially in cases of psychosis or whatever the case may be, medication is important, and medication sometimes can be quite expensive. So it is important to kind of understand, okay, this is the medical aid I have, or if I don't have a medical aid, what is my budget for medication? Because one thing is a counseling, one thing is a rehab, but the medication aspect also needs to be considered. Okay, so limited mental health care services. Access to mental health care services may be more challenging without insurance, which can be significant issue for individuals with co-occurring mental disorders. So, for example, it's quite difficult to kind of find one that is a dual diagnosis. In the government sector, it may be an addiction center, or it may be a psychiatric facility, but very likely that it's going to be a combination where it's tackling depression and substance abuse. So like I say, limited healthcare services. Okay, so I just wanted to give you a little bit of pros and cons of having health insurance. So the next thing I wanted to talk about is a little bit about the forms of kind of therapy, or the forms of what therapy provides and what that may mean for you. So think about this more specifically in the form of you supporting a family member that has an addiction. For example, let's just say you are a parent and you have a child in rehab, right? You yourself need to take care of yourself to be able to be providing the best support that you can. It's not your job to get into your child's head and figure out what it is. That's where the healthcare professionals come in, and that's their job. Your job is to take care of your mental health and be the best version of yourself. So in order to do that, there are certain kind of aspects of the mental health area that you may want to consider. For example, we talk about individual therapy. So, family members can benefit from individual therapy or counseling to address their specific concerns, emotions, and coping strategies. They can seek a licensed medical healthcare professional, such as a therapist or counselor or psychologist with experience in addiction related issues. For example, you have a job, but you've got a child in rehab. There may be things that you're dealing with, things that you maybe are not dealing with in the healthiest way. Maybe things that you feel like is becoming a bit of a problem, or emotions. For example, having a difficult boss or manager can really, really put a lot of strain on you, added to the pressure of having a child in rehab. So it's very important that you prioritize your mental health, right? So like I said, maybe your coping strategies may not be very healthy, and you may need to talk to a counselor about that, or a psychologist. Okay. The next thing we want to talk about is family therapy. So one thing is individual, right? Me as an individual, but let's just say mom and dad have a child in kind of rehab or dealing with addiction. it's important that the family is involved in this, right? So family therapy involves all family members that are necessary and individuals with the addiction. So as a combination to see how can we improve communication, understanding family dynamics and helping everyone work together to support the recovery process. We look for an addiction that specializes in family therapy or addiction. But the kind of main component that I want to talk about here is family therapy is based on communication. Communication, like we talked about in previous, presentations, is that sometimes some family members are a bit dominant and some are quite passive. So a therapist comes in there as a mediator to say, okay, dad, you may be a bit too dominating. We need you to take that down a tone. Mom, you're a little bit too passive. We need you to kind of bring it up. Maybe the son or the daughter or the family member dealing with addiction is not really talking about it. We need them to open up. So they play as a mediator to kind of bring a balance in communication. The idea there is that we teach you guys how to kind of communicate with each other, and you guys do the same thing by practicing at home. Just to recap, things like a talk pillow. If somebody's talking too much, you need to kind of give them a pillow. When you have the pillow, that's when you can only talk. And the pillow kind of bounces between the group so that everyone has a fair chance for talking and being listened to. Another thing is also eliminating distractions, right? Don't talk when there's small children present about sensitive issues. Don't have the TV talking. Be comfortable. Don't be standing up and talking. This is things that your therapist will talk to you if they're noticing problems in the communication. So just a little thing that you want to consider. So we talked about individual therapy, that's with you, as well as your family therapy. And next we talk about support groups, right? Support groups like the one that some of you may be joining, like Al-Anon, Nar-Anon, Family Anonymous, are specifically designed to help family members of the addict, right? You guys need a community of your own as well, right? Just as the person dealing with an addict is surrounded by community members, so do you need to be surrounded. This group provides a safe space for sharing experiences, gaining insight, and receiving emotional support. The key word over here is safe space, right? There's no shame, there's no kind of hiding the fact that you have a family member with addiction. And once we kind of deal with that elephant in the room, then the process becomes a lot smoother. I'm not embarrassed to tell you that my loved one is an addict because you're in the same meeting. And we kind of bond on that. We kind of form, kind of relationships or communities with this group, and kind of, provide support when they need it. They provide support when you need it. And more importantly, just to gain insight and receive that emotional support. Just on that one, make sure that your support group that you're joining is accredited or does have some sort of structure to it. Make sure that you're researching and you're not just going to any kind of meeting. It is important. Okay, next we talk about educational programs, right? This normally happens online, seminars online. There are various sorts. The one that you kind of watching right now would be considered to be an educational program, right? Some organizations offer educational programs for families to learn about addictions, its effects, and how to provide effective support. These programs may include workshops, seminars, or online resources. So family support that you're listening to right now is what we call an educational program. Very important, sometimes for basic knowledge, for questions, just for a time for that you can feel free to ask what you want to ask and learn about something in this field. The other one we talk about is community health services. Many communities have mental health clinics or centers that offer counseling services. Don't be afraid to access these services if you need it, right? If there's a community center in your area, go and find out, see if they can be of any service. Maybe they can provide some resources that you haven't even heard about. But if you don't know, if you don't ask, you won't know. So families can contact their local community mental health service to inquire about what they can offer. Another
Sorry, Keegan,
thing that some of the families may have access to, especially if you're in the working field, is employee assisted programs, or EAPs or EWPs. Now, the nice thing about this is, or the idea behind this is, you as an individual are treated with respect in your workplace. They treat you with respect. They value you. They know that in order for you as an employee to be the most, to be the best version of yourself, you may need some support, right? In other words, they need to make sure that the tools that they have are kept in the sharpest version of themselves, so they can perform. And so they implement an employee-assisted program. Now, what this does is it allows employees to access counseling services, not only counseling services, but things like legal services or finance services. What this does is that it helps individuals that have a job access counseling, or kind of maybe you have a legal query that you want. So check with your management or your HR if your company does offer an EAP or some sort of system, just so that you can check if you're eligible for such services. The nice thing about EAP is it doesn't just cover your employee, it also covers immediate family members like siblings, like children. Just check and see what they can offer. You may not ever use it, but it's important that you know that it is there for you. So check. Another thing we talk about is private mental health care professionals. Here we talk about, again, some of this may be, like I mentioned in a previous slide, talking to therapists, psychologists, or psychiatrists specializing in addiction. So you get a specialist psychiatrist or specialist psychologist that's dealing particular in addiction. And these professionals can provide individual counseling and treatment plans, right? Another important one that I've seen, take up after COVID-19 was the one of telehealth or online therapy. Has become quite increasingly popular and accessible. Families can access mental health support from the comfort of their own home. Maybe if you don't have the time or the accessibility or the resources to travel, you can access telehealth. Things like Psychology Today, Headroom, there's a lot of things that you can access, right? In order to kind of make sure that it is as convenient for you as possible, right? So kind of check on that. If you're interested in that, do some research and see what's available for you. Just make sure that it's an credible source and it is legitimate. Community organizations and nonprofits. Some nonprofit organizations and community groups offer free or low-cost counseling and support services for families dealing with addictions. So, we talk about Red Cross, we talk about what's the other one? There are a few others, right, in South Africa. So just check up on that. If it's something that's available to you, make sure that you're accessing it, right? It may be free or it may even be low cost. Primary care physicians and referrals. This is important because a family's primary care physician, like your GP, can provide a referral to a mental health professional or addiction specialist. So, for instance, right, you don't know about addiction too much as a parent. You suspect that your child may be using substances. Option A would definitely be to take them to a rehabilitation for that. But if option B is to take them to a doctor, the doctor can maybe do a drug test and advise to say, okay, this child is maybe experimenting with substances. You may want to consider taking him to the following rehabs. So if you consult with the physician as your first, they can provide additional resources. Before I move on, I just want to ask Dom, do you have anything that you want to add on to that, or just a little bit about, the various aspects that we can access, the healthcare facility?
So I didn't really, I didn't want to add on to that, but there was a question from Merle. She was just asking, do you have any experience or info re-exclusions if someone wants to join a medical aid post-diagnosis and in recovery? So Merle, I think from my experience, there's usually a 12-month exclusion. So they normally have to wait about a year before they can, gain access to those services. It's not a full exclusion, but there is generally a 1-year waiting period.
Okay, I'm so sorry, Dom. I think I may have had you on silent. Can you just repeat if you wanted to add something on this?
No. That's not on this. I just wanted to answer Mill's question.
Oh, okay, no problem. So like I said, that was just a couple of ways that you can access healthcare services, right? EAPs, telehealth, private, public. But now I wanted to move on to something that's quite important, right? So picture the scene where you, as a parent, or you have a loved one, a partner, a spouse who's dealing with substance abuse, right? That's one trauma in itself. But what happens if there's another trauma on top of that? So just to reiterate the importance of taking care of your own mental well-being to be the best version of yourself, right? To help your loved one through this process, right? So like I said, uh, you've got a loved one in rehab, but you met in a motor vehicle accident. Those are two traumas, right, layered on top of each other. So just keep that in mind. Increased stress and coping challenges. Dealing with a new trauma can increase your own stress levels and emotional distress, right? Coping with the trauma while also dealing with the family member with members addiction can be overwhelming, right? So like I say, uh, life isn't perfect in the sense that it's not going to wait just because we have an issue or a loved one in rehab. Life tends to pile on, finances, anything can be a trauma. Being let go at work, or uh, you know financial issues, they come into your life and do tend to raise your stress levels and emotional distress, adding to the importance of why I say it's important to prioritize your mental well-being and also access the services that you can, like a counselor, like a psychiatrist, like a physician. They also cause a distraction and neglect. When focused on your own trauma, right? Or in other words, trying to deal with the trauma of, like I said, an accident by yourself, you may have less emotional or mental energy. We talk about a social battery or a body battery. Less emotional energy to devote to the supporting your family members' recovery. This distraction can hinder the process. I use the word hinder, right? Because it's not your responsibility as a family member for their progress. They are fully responsible. But we use the word hinder because let's just say your family member, your son or your daughter or your spouse is talking to you about something important, but because you've never processed the motor vehicle accident that happened yesterday, you're looking at them but you're deep in thought somewhere else, right? So we actually just not giving them our 100% attention, which is important. So, in other words, what I'm saying to you is in order to kind of be the best version or best support structure that you can be, prioritize yourself first. Instead of talking to them first, instead talk to a counselor, deal with a little bit of the trauma, right? See what they offer. Maybe, need to visit a doctor or something of the sort, and then try to reintegrate in terms of being a support. So, like I said, distractions and it can lead to distractions or neglect. What about unresolved family dynamics, right? This trauma may bring to the surface unresolved family dynamics and tension. These issues can contribute to enabling behaviors, codependency, family conflict, making it difficult to support the addict effectively. For example, mom and dad are separated, right? They've gone through a very bitter divorce, right? And on top of that, there is an issue of lack of finances. So we've got history of a divorce. We've got the current new issue of no finances or trauma of losing a job or no finances, and the added issue of having a child in rehab. So we talk about unresolved family dynamics, right? So this is important because it can bring unnecessary issues back up to the surface. And now it's a situation where we're fighting for one's attention. We're letting things slide because we actually want our child or our loved one to kind of pick us over the person that we're fighting for. It's like we want our son to pick us over their father or their mother, right? So what we do is we tend to enable their behavior. Oh no, it's fine, you don't have to go to a meeting today, it's okay, it's raining, and then we're trying to get favor with them so that it makes look like the other parent is at fault. So what I'm saying is trauma can bring about unresolved family dynamics. So the reason I bring this up to you is because we see it often, and we're saying to you, get these issues, deal with these issues as an individual, so that it doesn't become a stumbling block for becoming a support structure to your loved one, right? So like I say, codependency, enabling behaviors, these are things that need to be worked on. Relapse triggers, right? We talk about people, places, and things, right? And as a support structure, it's not your job to kind of uh, help your loved one avoid people and places and things. But during the initial phase, it can be quite helpful. The stress and emotional turmoil caused by a new trauma can trigger relapse in an addicted family member. Individuals often turn to substance as a coping mechanism when faced with overwhelming stress, right? Relapse triggers. So, for instance, bringing up unnecessary, conversations that you have not dealt with, can be a trigger. Taking them to places that you felt were special for you, but maybe may bring a trigger for them. So, in order to figure that out, you need to work with your counselor or your therapist to figure what are the kind of emotional turmoil that I may cause. And it's very important to keep track of this. Another aspect is reduced communication. A new trauma can lead to communication breakdown, like we mentioned, within the family. Misunderstandings, resentments, a lack of open dialogue can hinder the family's ability to address and manage the addiction issue. So, using the example of parents divorced, or death in the family, or, financial issues, they cause a sense of resentment or misunderstanding. And that can kind of, if I see, the parents kind of fighting over finances, the person or the child would be a little less, but relentless to kind of, come and approach them and tell them a little bit about what they're going through, their struggles. So it's always important to kind of be cognizant of the family dynamics, because it can play a part in reducing communication. Before I move on, Dom, do you just want to add a little bit onto this?
Um, yeah, I think this is quite an important subject, because I think it's really important for the family to kind of look at themselves as well. Because your loved one is in treatment, getting the help and care that they need and dealing with their triggers and their traumas and that. But I think the family also needs to do their part and get their therapy and kind of resolve their issues. I don't want to say issues, but just to see maybe where you're enabling or where you're rescuing, or just kind of work on your own dynamics and boundaries, so that when your loved one does come home, everyone's more or less on the same page, and there's no issues when, well, I mean, there'll be issues, but there'll be a lot less when your loved one comes home.
Absolutely. So, for the sake of time, I just want to go through this a little bit faster. Traumas tend to cause a reprioritizing of needs. Individuals experiencing trauma may need to prioritize their own well-being and recovery over that of the addicted family members, so that they can shift the focus and support. So what I mean to say here is, you need you as a loved one are also going through your healing and your recovery, right? We call it your recovery as your own. So you need to just make sure that you're prioritizing your trauma, so that you can deal with it, so that you can make sure that you are the best version. Just reiterating that, right? Mental health issues. Sometimes we have, as parents or as loved ones, we have mental health issues that are exacerbated by trauma, like having a child in rehab. And this can kind of, things like depression, anxiety can surface. So, like I say, if you see any symptoms of this in your kind of in your lifestyle, depression, which be not eating right, not losing weight, things like that in yourself, that you're noticing, this may be a bit of a problem. I'm not sure what's going on. I know I have a child in rehab, but maybe there's something deeper going on. Go to your healthcare professional. They will advise you accordingly. You may have an early onset of depression. If you don't go, you won't know. So, like I said, just making sure that you're keeping an eye out on that. Loss of boundaries. Family members may struggle to maintain healthy boundaries when dealing with their own trauma, making it challenging to set or enforce limits with their addicted family member. So, for example, right, we talk about codependency, but we also talk about dealing mom and dad are having an intimate conversation about something like finances, and something that a child does not need to, or their child doesn't need to be part of. But if this is being discussed with them, or the boundaries are being blurred, the child or the loved one can take advantage over that situation and start to manipulate. So it's really important, when you guys are dealing with your own trauma as a family, it's important to respect boundaries. Certain topics can be discussed with them, certain topics can't. So make sure that you're talking to your counselor about it, if you can include them in that conversation. Strained relationships, right? We talked about relationships in the family. Maybe mom's got a new boyfriend or dad's got a new girlfriend. That's putting strain on the existing relationship in terms of how we communicate. That could be seen as a trauma for them, or they could be seen as a trauma for the person, who has to deal with that. So what I'm saying is, these are things that need to be considered, as well as escalation of crises, right? So, for example, a person is diagnosed with cancer that is, now, turning from stage 1 into stage 2. Crisis is increasing, and this requires harder, intervention, more family counseling, so that the person dealing with an addiction is aware of the severity. So, like I said, just highlighting a little bit of why it's important to access it, right? So I want to go through this one clear, because it's just basically a repetition of the previous slides, but just saying that if you want to access the mental health care services, you can do so in the following ways, right? So we talk about the public healthcare system in South Africa. We talk about the private healthcare systems in South Africa. We talked about the EAPs, which is Employee Assistance Program. We talked about community healthcare centers. All right. We also talked about NGOs, telehealth, support groups, like Al-Anon, Nar-Anon, and crisis helplines, which I may have left out. We talk about Lifeline and the suicide crisis. There's the number there if you need it, but if you're in a different country, you may just Google search and see one that is based on your location, and as well as community-based services, right? So exploring community-based services centers to kind of find a low-cost option. The last slide that I want to talk about before we end is, the reason of cultural sensitivity. Dealing with mental health is a very sensitive issue, and it's important to know that, a professional, a healthcare professional, emphasis on the word professional, right, is somebody that adheres to cultural sensitivity. So why is this important? In South Africa, we all have diverse beliefs, and it's important for your healthcare professional to respect your diverse beliefs. Cultural sensitivity respects incorporates these beliefs into treatment, which may even enhance engagement outcomes. Another important thing is like addressing stigma, right? Certain cultural backgrounds may carry stigma around addiction, such as, men don't see counselors or something of that sort. So it's important to know that when you go to a healthcare professional, they are professional enough not to kind of bring any stigma into that. That's why they call them professionals. It's important to understand that they aim to build a trusting relationship with you. So despite your cultural background, they are there to provide a trusting relationship. So just keep that in mind. Tailored treatment. Cultural sensitivity allows for customization of treatment plans, addressing individual specific cultural and social needs, which can result in more effective outcomes. Also, support for co-occurring issues, right, is very important, because addiction issues may be more prevalent in a specific culture, and that needs to be taken into consideration. So I've just got a list here. You can't take it down or take a screenshot of this, but just a little bit of kind of helplines that you may want to access. For example, substance abuse helpline. You've got the contact number there. SADAC, Al-Anon, Sanka, National Crisis Helpline, Lifeline. So these are things that you may want to access, and if you're having trouble, you can always try to access it by the internet. You'll definitely be able to help somebody to point you in the right direction, okay?